Weight loss drugs like Wegovy and Ozempic have been making headlines all around the world in recent years. Now, a new study suggests their health benefits go beyond slimming down. So, is this the miracle drug some are claiming, or is it just too early to say? Hello and welcome to Roundtable. I'm Enda Brady. Now, people are living longer. That means more pressure on healthcare providers around the world. Any drug that improves chronic conditions could be a game changer. So, is Wegovy that drug? And should we be skeptical?
Semaglutide, the active ingredient in Ozempic and Wegovy, has been revolutionary for those who medically need to lose weight. Now, it appears the drug lowers the risk of cardiovascular disease as well. A study, founded by the drug maker, followed over 17,600 adults, aged 45 and over, from across 41 countries with a body mass index over 27. They had all suffered previous cardiovascular events, like a heart attack. 17% dropped out of the study because of the side effects. Of those remaining, the group taking Wegovy had a 20% lower risk of heart attack, stroke, or death than the group taking the placebo.
So a really impactful results that we believe will change the way that we both view, but also potentially treat obesity.
Another study found patients taking Wegovy maintained an average of 10% weight loss over 4 years, suggesting it's a sustainable treatment. In 2022, 1 in 8 people in the world were living with obesity. Globally, adult obesity has more than doubled since 1990 and has quadrupled in adolescents. The associated health risks include cardiovascular disease, diabetes, cancers, neurological disorders, chronic respiratory diseases, and digestive disorders. If nothing changes, the global costs are projected to reach $3 trillion per year by 2030. Long-term, being able to effectively treat obesity will hopefully lower the prevalence of the more serious chronic illnesses that result. Preventative medications could be key to easing the financial strain on under-pressure health systems. There are reasons to be cautious. A weight loss drug called fen-phen, used by 6.5 million people in the 1990s, was recalled by the FDA in 1997 after it was found to cause lung and heart complications. But for now, the signs are positive. There are reasons to be optimistic about Wegovy. It also appears to be shifting perceptions and language around obesity, which may encourage those who are suffering to seek help.
Well, let's meet our guests. Joining us from Limerick in Ireland is Dr. Mary Ryan, a consultant endocrinologist and senior lecturer at University of Limerick's Secours Hospital. In London, we have Dr. Alexander Miras, clinician scientist in obesity and diabetes at Ulster University. And in Bath in the UK is Dr. Bharat Pankhania, senior clinical lecturer at University of Exeter Medical School. A very warm welcome to Roundtable to all of you. Mary, I'll come to you first. Is it time to start believing the hype about Ozempic and Wegovy? What are your thoughts?
Yes, absolutely. I mean, as doctors here, we're so interested in caring for patients, and it's wonderful to have a drug when we think we're in an epidemic of type 2 diabetes in the Western world and obesity. It's absolutely wonderful to have a drug that actually helps along with diet and lifestyle. So obviously, as doctors, we're always talking about diet and lifestyle, but obesity is a very complex disease. It's, hormonal. It's got to do with, there's so many complex factors involved. And even though patients do their very best with diet and lifestyle, with the help of dietitians, doctors, psychologists, still it's very hard to bring morbid obesity down to normal, healthy BMI. So to have a drug that's so effective, like the Ozempic and Wegovy, which really helps by delaying gastric emptying, by have that feeling of fullness, and with the studies and now the years of experience, that it really does work and overall is very well tolerated. As a clinician who's dealing day in, day out with obesity and diabetes, it is wonderful because the benefits are huge. The benefits, we're in an epidemic of obesity and type 2 diabetes. We are all at crisis point in our hospitals. And we know that by reducing weight, that we can really improve diabetic control. We can reduce endpoints like kidney disease and eye disease and heart disease. Remember, 75% of our type 2 diabetics will end up in with heart disease. So by reducing obesity, you really improve your diabetic control in your type 2s, and you reduce insulin resistance. So to have a drug that's helping us achieve these objectives and these targets is absolutely wonderful. And as I said, it's also very well tolerated for the most part. So we're using it in conjunction with diet and lifestyle. But to have a drug like this is just wonderful when you're in the area that I'm in. So I'm thrilled, and we're all thrilled.
Alexander, have you ever known a drug have such an impact in such a short space of time?
So this is the medication that has really changed the narrative. We know not Wegovy, and I want to make sure that we're all talking about the same thing. So I'm talking about semaglutide at a dose of 2.4 milligrams for the treatment of obesity, causes a weight loss of an average weight loss of 16% at 1 year, which is double-digit weight loss we have not been able to achieve before with pharmacological therapies. And a significant proportion of people will lose more than 15 and 20% of their body weight loss, which is a trajectory that up to recently bariatric surgery was able to achieve.
Wow. Bharat, is it too much to call this the drug of the century? I mean, the media hype, every time I pick up a newspaper, click on a news app, it's Ozempic this, Wegovy that. Is this the drug of the century?
I think we should stop the superlatives, because when the superlatives long-term produce some glitch or not, it tends to affect our confidence long-term. So it's better to be precise, it's better to be informative, it's better to be controlled in how we present it. Of course, it is a good drug. Of course, it does what it says it's going to do. However, it hasn't been used long-term, but more importantly, it is not a magic drug on its own. And that is a very key important message. It is a magic drug that works in hand with diet, exercise. So it's diet, exercise, and medical intervention. And we mustn't forget that just because you've been given Ozempic or its similar derivatives, that you don't have to take care of your diet, or you don't have to take care of that exercise. And also with diet, it's not only I don't want to eat fatty foods. Good nutrition is important for other aspects of good health as well.
That's a very good point, Mary, isn't it? Do you think we need perhaps a bit more education to go along with the weight loss jabs, that it's not just a miracle treatment, that people maybe need to change the lifestyle issues that have led to them being obese in the first place?
Yeah, but I think patients with obesity, yes, lifestyle is an issue, but a lot of patients with obesity, they have been adhering, like, in all our clinics, we always start with diet and lifestyle and exercise. And not someone who's in a morbid obesity situation is not able to exercise as well as we would like. So I think this is where these drugs come in. But I think we've always, as physicians and nurses and all our clinics, have always started with diet and lifestyle. And it's wonderful then to have a good drug that we can add in that can get the weight reduction further and motivate the patient to really adhere to diet and lifestyle more. So I think that was always the preface, that we always did do diet and lifestyle, but to have a drug that really enables us to get more weight reduction. And they really are losing significant body weight, 15% of body weight with Wegovy compared to 2% on placebo. That's huge reduction, and that really motivates that patient. And obesity, yes, of course, there's certain patients, we of course improve diet and lifestyle, but an awful lot of patients are doing their damnedest and not losing weight. And you do need something to help with that, and then it motivates them further. Obesity is a very complex process. It's not all down to diet. It's also hormonal issues, insulin resistance, as we see in patients with women with polycystic ovaries, abdominal obesity. That actually can can drive the obesity process as well. So it's not all down to diet, but certainly in our clinics, we always emphasize a three-pronged approach: diet, lifestyle, personal responsibility, as well as medication. And that's, in fact, the way in all our diabetic clinics, and that's how we achieve good control, and it's training the patient to sort of take personal responsibility for their health. So we always take that three-stranded approach for both diabetes and obesity, and it's one that really works. But I think having a drug that really helps and the patients can see definite results, that motivates them further to keep going. And that's where the phenomenon is here with these drugs that we have now available.
Alexander, I've seen headlines saying that it... Yes, of course you can, Dr. Barrett. Off you go.
So all I wanted to say is, yes, that is fair. And that is the clear message. In other words, the message is, look, for a long time, we did not have medication that could help you. Now we have medication, but with this medication, you will expect to lose weight, and we would like you to eat well. And then as you lose weight, you will also be able to exercise more. And the more exercise that you can do, the better for you. And it is that creating that message beforehand that's very, very important, which is, yes, for a change, we can now tackle your type 2 diabetes, your obesity. We've got a drug, and then that drug is going to help you, but you will also help yourself with increasing your exercise as you lose more and more weight.
Alexander, talk to me about the other issues. I've seen that this drug can help treatment for addiction issues and even dementia. So we're learning more as the months and years go by of Wegovy and Ozempic, yeah?
Yeah, so these are all treatments that are based on the hormone called GLP-1, which is a hormone that we all produce from our intestine when we eat. And what we are discovering over the years is that, first of all, this hormone is important in the control of glucose. Then we are realizing that it is important for the control of body weight. And now we are expanding our therapeutic indications potentially to other organs that we could not imagine previously would respond, and other diseases that we did not expect would respond to this medication. The best example is Parkinson's disease, and I'm saying that because we have got data now about that, and GLP-1, the receptor agonist treatments for people with Parkinson's delayed the progression of their disease. So we think that this hormone and these medications reduce inflammation and have a neuroprotective effect, protect the nerve cells in the brain. Potentially for dementia in the future. The addiction is a little bit more complex because, and I've heard about these stories about changes in the addictive value of alcohol or recreational drugs. I would say that yes, there is a small effect in some people, but we don't see it in the vast number of people that we are treating. It exists for some cases.
Well, the money is certainly rolling in for the parent company in Denmark. Let's take a look at the figures. Novo Nordisk is the company. Market value has now reached nearly $460 billion, making it among the most valuable companies in Europe. Sales of Novo Nordisk's obesity drugs jumped by 154% last year. Wegovy alone bringing in nearly $5 billion. The company's overall sales rose 36% to nearly $36 billion. And profit before tax jumped 52% to just over $16 billion. Mary, as more companies and more health services are looking for Ozempic and Wegovy, is it hard to get hold of in Ireland? What's been your experience?
Yes, well, we had difficulty. Thankfully, that's been resolved quite substantially now. But yes, we had up to about 2 months ago, we had problems. In Ireland, it's only licensed for the treatment of type 2 diabetes, so obesity in patients with type 2 diabetes. That's what it's licensed for in Ireland. We don't have access to Wegovy at the moment, as you do in the UK, but hopefully we will be getting it soon. So at the moment, we only have the 1 milligram Ozempic, and a drug called Saxenda then is used for, where we have that access to that for obesity. But yes, it's wonderful that we are hearing from the companies that they're increasing production across the world, and that we now have access to it, because what was terrible was we had patients doing very well on it, losing significant weight and being motivated with regard to their diet and exercise in losing the weight, and then not being able to access it for 2 and 3 months. And of course that was not desirable. So thankfully now it's back in stock, and hopefully that will continue. And we are hopeful that we'll also be able to get Wegovy, which is the higher dose Ozempic here in Ireland, for a certain subgroup of patients. So as I said, we're delighted to have it as a part of the treatment for type 2 diabetes. And it's wonderful. And I really believe we're helping reduce disease, both in our diabetics in the eye, kidney and heart disease, reducing also the burden on hospitals, because all of these patients, if you're going to reduce all of these diseases, you're going to reduce admissions to hospitals, and you're going to reduce economic costs as well. So the overall benefit to the patient, to the hospitals and to the economy, I believe is massive. And that's really what we as doctors and clinicians are very excited about, that we're reducing the burden of disease for the patient, but also for the entire country. So we're really happy with that.
Bharat, I want to ask you about side effects, Bharat. Bharat, just tell me, I've read about nauseousness. Talk us through the side effects connected to the drug.
So the side effects are not in all people, and they sometimes also resolve by their own. So it's a feeling of nausea, sickness, diarrhea. But more than that, what I wanted to say about what just Mary has said is, when you're making a health economic analysis, the use of that drug far outweighs the costs of not using that drug, because in not using that drug, and you have poorly controlled type 2 diabetes, for example, you then have problems with your eyes, your kidneys, your heart, and other things. And all of those things cost money. Whereas if you were to implement the use of this new drug that works, then the economic costs, the healthcare costs for type 2 diabetes come down.
Alexander, just talk to me about where we go in the UK with this drug. Are we going to reach a stage where the National Health Service will basically take it on and it will be a routine and regular treatment for people struggling with obesity and diabetes and all the connected issues?
In the UK, the National Institute for Clinical Excellence has gone through the cost effectiveness data for the medication, and it has decided that it is cost effective for people who have got a body mass index of 35 and one obesity related complication. So now we should be already offering the medication in obesity clinics throughout the UK, but the problem is that we are not. Even though the NICE approval is legally binding, it has to be implemented. It's not an option. The reason why it's not being, Wegovy is not widely available is because the integrated care boards that fund services have refused in the majority of cases and in most ICBs to fund the medication. So at the moment, very, very few hospitals are offering the treatment.
Mary, should we be concerned about various different companies who, may manufacture a similar product, or copycats who kind of have realized what's going on here and the vast amounts of money to be made? I mean, is there a concern about copycat pharmacists knocking out a cheaper product, inferior product maybe?
I suppose we use generic brands, which is what that is, in all other drugs, and you would be hoping that pharmacovigilance would apply and that the regulatory drug regulatory boards would be checking that out, and I would have confidence that they would. But obviously, that's something as clinicians we're always querying: are the generics the same as the real drug? We would like to see studies done on that. But for the most part, with all our other medications, when they become off patent, then other companies are allowed produce them, and that's what we call generics, and they obviously are much cheaper. But we are assured that they are the very same. So we would only hope that the same checks would be done for Ozempic and Wegovy. But that's a very good point, and it's always something we're concerned about as clinicians. But certainly it's something that we would insist on. And I suppose for those, when we're doing that continuity of care, which of course you do when you're a diabetic patient, it would be very obvious if it wasn't as good. I think you would know pretty much straight away, because you're seeing that big reduction and then that maintenance of the weight loss, along with them adhering to all the other principles that we've spoken about. So I think we'd know as clinicians if it wasn't as good. But obviously, as doctors, we're always looking out for any changes and why that we mightn't be getting the movement and weight that we're not. So certainly at present, we are very attuned to generic brands, and we're assured that they're the same. So the same principles, I'm assured, would apply to Ozempic and to Wegovy, and we would insist on that as clinicians.
Bharat, I want to talk about the long term. So it's all well and good. You get your jab, you lose your weight. How long does it stay off for? I mean, do people have to keep getting regular jabs for it to stay off, or is this a kind of balloon and shrink issue?
We don't know. So the long-term thing is that at the moment the drugs are licensed for a 2-year treatment regime, and what happens beyond the 2 years, I really don't know. But we will cross that bridge when we have to. I assume that it will be something that we would need to take on a regular basis, because if the hormonal, which is what it is, we are tackling hormonal inputs here, hormonal signaling, then it's not a case of you are treated for 2 years and then it's all over, you'll be fine forever. I really don't know what will happen beyond the 2 years.
Alexander, what are patients saying to you when you have that discussion and you're telling them that you feel the best course of treatment is Wegovy or Ozempic? Are people excited? I mean, there must be a lot of chatter about this because the media headlines are just incredible.
Yeah, they are very excited, and it's because suddenly there is something which does not involve a surgical intervention. Yes. To cause something which is meaningful in terms of their weight, but also more importantly in terms of their health. And the people that come to me are not people who have not tried before, like Mary, to lose weight. They have tried multiple times, so this is suddenly an option. But what I always clarify is that these treatments should be given long term. Yes. It is not a short course. Even though the National Institute of Clinical Excellence has approved it for 2 years, it needs to be given long term, because what we know is that when the medication is stopped, the vast majority of patients may regain the vast majority of their weight.
Mary, what does that do to someone then if the weight comes back on? I mean, these are people who I'm assuming have struggled for years and years to get their weight under control. This magic pill jab comes along, and then if they stop it, the weight goes back on. Psychologically, what does that do to a patient?
Well, I suppose they lose heart, and as we said, these patients have tried for years, and then they suddenly get the weight loss. But to answer your question, yeah, it's dreadful. And with any treatment plan, and particularly when you get it working for a patient, you want it to stay, and you want to keep the momentum going. And for a patient who is really so getting such benefits. From a movement point of view, from a respiratory point of view, it really helps with sleep apnea. Remember, they breathe way better, for their joints, for their cardiovascular health, if they have diabetes as well. So for all these, and then for them to go backwards because they don't have the treatment, it's dreadful, and they've got to climb that hill again. So we don't want that, and that's not desirable at all.
Bharat, Is that a worry for you that one company seems to have huge power now in this market?
Well, that's the way the pharmaceutical companies have been set up. If you fund the research program and you draw up proper contracts, you may get those drugs at a cheaper level. But unfortunately, I remember when Glaxo invented their H2 receptor antagonist, that's the anti-ulcer drugs, Zantac and ranitidine and all those things, they made billions. Unfortunately, that is the way the pharmaceutical companies work, and perhaps internationally, we should be working on a memorandum of, when you are successful, maybe we extend your patent for longer, so we give you the rights on your drugs for a lot longer period, and in return, you don't charge as much upfront for your successful medication. In other words, it becomes more affordable globally.
Alexander, final question to you just briefly. Do you think the price will come down in future years?
Yes, because we've known that for other disease areas, and we now know there are at least 2, if not 3 more companies that are getting in the field of treating obesity. Competition always brings prices down, and we are seeing that with a newer generation of medications that have come out, in the UK at least. So yes, that will happen like in any other drug.
Doctors, thank you all so much for your insight. We will see you again on a roundtable, but for now that's it. Remember, you can see more discussion and debate on our YouTube channel. Just search for Roundtable TRT World, and if you like what you see there, please do hit that subscribe button. But for now, from me and Brady and all of the team here, goodbye and thank you for watching.